So here's the brief introduction into what we're going to talk about on Thursday. So we kind of figured out the microbial growth, and that leads us, it's a nice segue, into the main approaches to the bacterial control. There are many routes that we can take. We can classify the approaches based on the nature of a method, whether it's a physical or chemical method. But whether it's killing or just limiting the growth, but we're going to focus mostly on two aspects of microbial control methods. Whether they are used on inanimate or animate objects, we call inanimate objects fomites, versus living tissue, and what level of, say, cleanliness these protocols allow us to achieve. So major protocols that are used on the fomites, there are three of them. The sanitization protocols are quote-unquote least clean. Okay? So they reduce the microbial load but never eliminate microbes completely. When you run a dishwasher cycle or you clean a restroom applying chlorine bleach, essentially you do sanitization. You do poison some of the microbes, but you will never poison all of them. Does that make sense? Now, second level, if you want to kick it up a notch, is the disinfection. So disinfection reduces or eliminates microorganisms on the inanimate items. Okay, and these are the protocols that are most frequently employed in the labs and the hospitals. Okay, so on the clinical surfaces, in most cases, will be disinfected, so they will not be considered sterile. They will be disinfected. Does that make sense? And the most thorough type of a protocol is sterilization. Sterilization protocols completely eliminate all signs of microbial life, including vegetative cells, meaning reproducing cells, endospores, fungal spores, protozoan cysts, viruses, from any inanimate item. These protocols, as you can imagine, are the most aggressive, whether they are chemical or physical protocols, and they will be used on fairly resilient items, such as, for instance, surgical instruments. Does that make sense? Items that absolutely must be 100% sterile. Of course, we cannot use extremely aggressive protocols to control microbial growth on the living tissue. So two main protocols that are used on patients are antisepsis, which reduces the microbial load, and that's important, through the application of chemicals. That would include hand sanitizer, antisepsis, betadine, antisepsis, wiping the surface with hydrogen peroxide. In all these cases, whether it's betadine or alcohol or hydrogen peroxide, they kill microbes because these chemicals are toxic to microbes. They poisonous for them. Does that make sense? Now, in the procedure that is called degerming or degermation, microbes are removed mostly mechanically by scrubbing. So that would be hand washing. Essentially, the surgical scrubbing before the surgical procedure includes both degerming of the surgeon's hands and antiseptic treatment of those same hands. So both chemicals that allow effective hand washing, effective degerming, and chemicals that allow antisepsis are used. Does that make sense? So in our conversation about different methods, we're going to heavily focus our attention on whether this method can sterilize or disinfect, whether it can be used on the living tissue or not, and if it can be used, which level of quote-unquote cleanliness can be achieved. Now, we're not going to watch the short movie today. We're going to watch it on Thursday, which is a pretty cool movie. But I want to say a few words about biocontainment levels. If you have a patient with an unknown disease, you often have to consider how to prevent a spread of a potential public health threat. In the United States, there are 4 biosafety levels, or BSL, and microorganisms are assigned to each of these levels by basically scientific consensus. The main role in this is played by CDC, FDA, Food and Drug Administration, and United States Department of Agriculture. They actually have a special service called APHIS. I don't remember what it stands for. So BSL-1. Microbes are not virulent in healthy hosts and have minimal risk to the people or environment. The overwhelming majority of microbes that we are working with are BSL-1 microbes. Does that make sense? Now, Bsl-2 microbes are first indigenous, meaning they found in that location. Like Staph aureus is commonly found anywhere in the United States. They may cause disease with, different severity, but what's important is those diseases are either treatable, easily treatable, or preventable, or very, very mild. Let's say Staph aureus infection is treatable with antibiotics. Rhinovirus infection is not treatable, but the infection is super mild. It's a runny nose. Does that make sense? Usually pathogens that belong to BSL-2 level of protection, you have to work with them in the special biological safety hoods. It's a hood, like the ones right there. Slightly different type of airflow. The hood protects the operator from a pathogen, and actually pathogen from the operator, from contamination. Now, Bsl-3 pathogens are supposed to be worked with using a personal protective equipment, like this Tyvek suit. Okay? Microbes can be either indigenous, like Mycobacterium tuberculosis, or exotic, like yellow fever. And they usually cause serious, mostly treatable, or preventable disease. You can imagine yellow fever is a pretty serious disease, but it's fully preventable by vaccination. Mycobacterium tuberculosis is a serious condition, but its risk can be reduced by vaccination. It's not preventable. And the disease can be treated with a long course of antibiotics. Plague, for instance, is Bsl-3 pathogen because it's very treatable with antibiotics. Does that make sense to you? Good. Now, Bsl-3 environment requires complete isolation. We're going to kind of encounter it when we watch the movie. The person is isolated. The operator is isolated not only by the suit, but also by special device. It's either a mask or it can be a fully protective hood on the head with its own independent filtration system that will filter the outside air, trapping the potential leakage of the pathogens. Bsl-3 suites are separated. This room you cannot work with Bsl-3 in this room. You cannot install such equipment here. You have to design the suite separately with its own air handling system. Finally, Bsl-4 is the type of environment, type of containment that deals with exotic, extremely virulent, usually aerosol or contact transmitted diseases, which are fatal or extremely severe if they infect humans. Okay? In these conditions, operator is fully isolated from the work environment, wearing special suit and having an independent air supply. Typical examples of Bsl-4 pathogens are various viral hemorrhagic fevers, such as Ebola, Marburg, Lassa, Nipah. Different hantaviruses are Bsl-4 pathogens. Interestingly enough, in the United States, the disease called tick-borne encephalitis, pretty common in Europe. It's bad, but it's not that terrible. It's considered Bsl-4 pathogen for the fact that it's exotic. It is not found in the United States at all. So all measures are taken to prevent the spillover of that infection into the zoonotic, into the animals. Does that make sense? Now, you will need to know this protocols, match them, protocol and definition. Speaking of BSL, basically, I describe you a hypothetic pathogen, and you tell me which BSL level it should belong to. Believe me, I'm going to make it very obvious. Very, very obvious. For biosafety level, if I give you a description of a pathogen, you should be able to figure out which level it should be handled at. Okay? So we're going to wrap it up.